In my previous video on anxiety, I talked about the different kinds of anxiety there are and also looked at the symptoms of anxiety or the symptoms that characterize an anxiety disorder. In this video, we'll look at how the treatment for anxiety should happen. My name is Alexander. I'm a psychologist by training and I specialize in the treatment of anxiety, depression, and post-traumatic stress disorder. Now, the treatment for anxiety should follow a three-pronged approach. The first leg of which typically would look at how it is that the person comes to have the problem that they have. This is inside related work, psychological work that looks at how it is that the person contracted this problem. If you look at their family members, for example, you find that, well, the brother doesn't have the problem, the sister doesn't have the problem, but for some reason or the other they do. And it's really therapeutic for the person to know where this issue actually arose and how it is that they came to contract this particular kind of malady that they're suffering from. The second leg of the treatment process looks at why it is that the problem has continued to persist over time. Normally, you would expect that as time progresses, things dissipate, they rectify themselves, but for some reason or the other, the person's anxiety disorder has continued to persist and perhaps even gotten worse with time. Right? So for us, it's really important to know what are these maintenance factors, because there have to be some sort of maintenance factors that are ensuring that the problem doesn't go away and it just continues to sort of roll over as time progresses. So we want to know what are those maintenance factors that are allowing this problem to carry on as time progresses. Because knowing that, then when we are actually introducing skills and interventions, we can target those maintenance factors. So that brings us to the third leg of the treatment process. And this is where we're actually introducing real and tangible skills that the person can use to reverse the disorder of anxiety. Now, I use the word reverse for a very specific reason, because reversal, in fact, is possible. Elimination of the disorder is actually possible. In the work that I do with my clients, we do manage to achieve a very high degree of reversal. But we're not going to do it if we do not make elimination of the problem a specific goal. If we don't do that, all we're really doing are introducing coping skills. What we're saying to the person is, you're going to have to live with this problem for the rest of your life, and here are some skills, and so go and manage. And that's unfortunate because in the case of an anxiety disorder, we know that reversal is possible to a great degree. So I hope that this video has contributed a little more insight into your understanding of anxiety. If you have any questions or comments, please feel free to leave them down below and I will try my best to get back to you. In the meantime, good luck and take care.